Thank you all. It's a true honor to be here today to talk about what we're doing at FDNY and what we're doing with the entire fire service. None of this would be possible without your support, and I'm going to be demonstrating that to you as we move forward here in this presentation. What I'm talking about here is combined power, the power of everyone out there to make a difference. And where we're starting is by continuing the great work that you've already heard being done by NIOSH in their 3-city cancer study, and adding the FDNY cancer study to that. All right. Now, we all know that firefighting is going to cause cancer, but why is it plausible? It's plausible because at fires, we're exposed to all of these carcinogens: aromatic amines, metals, fibers, petrochemicals, polyaromatic hydrocarbons, dioxins, PCBs, reactive oxygen compounds, solvents. All of this is at every fire, and that's the basics for the bioplausibility that firefighting exposure is related to cancer. All right? We're building on basic science knowledge. And that led to the NIOSH study that you just heard about, where they went and they took 3 cities with a tremendous cooperation from management and labor to get all of these firefighters that had been working there since 1950 forward, ending the study in 2009, to put together the amount of numbers necessary for the first time to demonstrate in a fantastically scientifically designed study that firefighting can cause cancer. All of the other studies that you heard about were really studies that led to this study. This is the critical study. And here you can see that colon cancer, kidney cancer, lung cancer, mesothelioma, NHL, which stands for lymphoma, prostate, rectal, stomach cancer, were found to be increased. Some of these increased for the entire group, others of them increased for age-specific subgroups of firefighters in 3 urban centers: San Francisco, Chicago, and Philadelphia. Now, NIOSH used roster information to put all this together, like I said, with cooperation from labor and management. But that study ended in 2009. Huge amount of effort going into that study, huge buy-in by all of you. But unfortunately, as the federal government does things, they had no funding to continue this study. Worse than that, their agreements with the 3 cities was that if they were to lose funding, all of the data would be destroyed to maintain confidentiality. We went to NIOSH through the World Trade Center Health Program, through the funding that many of you have helped us get through the Zadroga Act, and we said to them, this study can't die. We have to figure out a way to use Zadroga dollars to keep this study going. And we came up with a very novel approach. We said, the way we can make this study World Trade Center related and keep it going is to consider these 3 cities as a control group for the FDNY World Trade Center Health Program cancer study. In other words, when we see that cancer is increased in FDNY World Trade Center firefighters and EMS workers, we don't know whether that's just the World Trade Center or firefighting plus the World Trade Center. We compare to the general population, it doesn't tell us that. But now we're going to be able to compare to these 3 cities, and it will be able to separate out firefighting and World Trade Center. So we'll be able to hopefully tell you which of these exposures are causing cancer and the cumulative synergistic effect between firefighting and World Trade Center exposure. This is going to be huge, huge benefit. But what it also allows us to do is to keep these 3-city study going on forward. So we'll have data and results that you will get for each of these cities. for the 3 cities combined and for the 4 cities with FDNY. And we are going to be able to continue this, and the data was not destroyed. We've worked for the last year since getting this funding in getting all the legal arrangements necessary so that we could receive this data. And I'm happy to say that just a few weeks ago, we received the final set of data from Philadelphia. We already had San Francisco and Chicago, and just a few weeks ago, in mid-December, we wound up getting the Philadelphia data as well. So now we are poised to really start this study. What we don't have is the data from 2009 forward, because the study ended. That's what we're going to be doing. And part of that is to find out, is to update all of the cancers that have occurred since then, and also the deaths that have occurred since then. We have a steering committee where the IAFF is going to have a member. Each of the 3 cities is going to have a labor and management member, and there'll be membership from FDNY and our World Trade Center Analytic Group. This will lead to complete total transparency, and it will allow us to do an additional thing that the NIOSH study didn't do. We're not going to just use this data, this roster information for cancer. We're going to use it to actually call all the members, to actually link them up with a website, and try to get data on other diseases that are of interest to the fire service. Is emphysema increased? Is asthma increased? All of these other diseases as well. So we're truly going to be expanding this study. All right. Now, here's a critical thing to understand. There's about 30,000 firefighters in the 3-city study, and I'll show you later with FDNY we're able to add another 10 to 20,000. But of these 30,000, enrollment ended in 2009. So what we have is we don't have enough power to look at everything. We don't have enough numbers to look at everything. For example, there's only 1,000 females in this study as of 2009. In addition, as you can see here, all right, many of these people, about 8,000 of them, were hired before 1950. What does that mean? Well, let's look at this. If we were to project out their age as of today, we would see that about 12,000 of the 30,000 are above the age of 80. That means that likely a good percentage of those are unfortunately have died, which means that we will have data of why they died and data up to their date of death, but our study will rapidly decrease in numbers from 30,000 to about 18,000. Right? Looking at this, so with that, we need to enroll more people. So another aspect of this study, once we start meeting with the steering committee, is trying to get newly hired firefighters as well. And that newly hired firefighters since 2009 will not only allow us to increase the numbers so that we can have the power to find out about cancer and hopefully other diseases, but it also will allow us to look at firefighters who have exposures to some of these modern building fires. Right? If you look at the data up to 2009, you can see that only about 3,000 to 4,000 were hired after 2000. We want to increase that number substantially. So we're going to add FDNY to the 3 cities. We're going to have greater power. We're going to be able to distinguish World Trade Center from firefighting. We're going to add other diseases of concern. And what we found at the World Trade Center, and what we published for the first in 2011, and have had many publications since then, is that World Trade Center did increase cancer in our firefighters and EMS workers. And we were the first to show that. And it's only because of this study that the Zadroga Act added cancer. Prior to this study coming out in 2011, cancer was not covered in either the Zadroga Act, the World Trade Center Health Program, or the Victims' Compensation Funding. So FDNY is very sad that we have this increase in cancer, but very proud that we were able to fulfill our commitment to each and every one of you that we would be transparent, that we would publish the truth, and that we would use the truth to advocate in a data-driven manner to get every one of you the protection and health care that you deserve. Now at FDNY, when someone comes down with cancer, their cancer is completely covered, not just as a pension disability benefit through presumption, but also their treatment is completely covered. I had a firefighter who came to me just a while ago, and he said that he'd come down with throat cancer, and it was really bad. And he was speaking to his doctor in one of the private health programs that his health insurance pays for. And he had signed up for this program to keep his costs down. And the doctor said to him, well, you know, we have an oncologist here that can treat this cancer. He doesn't have that much experience with this type of cancer, but we're going to set you up with an appointment for him. And we're going to get you that appointment in 3 weeks. And he said to the doctor, I might be dead in 3 weeks. He said, well, this is the best we can do. He said, well, I live in New York City. What about getting me into Sloan Kettering? And the doctor said, the program doesn't cover Sloan Kettering, this private health insurance program. So he went home and he's waiting for 3 weeks for an appointment to this doctor. And he's speaking to a friend, and the friend says, what, are you an idiot? Call up FDNY. You're covered in the World Trade Center health program. And he said, I thought cancer wasn't covered. And he said, no. This is all changed. Cancer's covered. Call up FDNY. Call up the World Trade Center health program. So we got a call from him. We got him an appointment to Sloan Kettering in 2 days. His entire treatment is covered. He's getting experimental chemotherapy at 0 cost to him and his family. No deductible, no copay, no nothing. The fire department has volunteers that drive him to Sloan Kettering 3 times a week for him to get his chemotherapy so he doesn't have to be vomiting on the way home in the train. This is all part of what you guys have allowed us to give back to you guys. He's alive. So we're going to add our 10,000 people to this, and we're going to keep on doing this study. What we've already shown in these 10,000 is that cancer, 10,000 with 85% being at the World Trade Center day 1 or day 2, so huge exposures. What we've already shown is that cancer is increased. And this increase can be looked at in a variety of different ways. One, the most conservative way, and we had to show conservative as well as liberal analyses to NIOSH to get this covered. But the most conservative way is that there's a 10% increase compared to the general population. That means that firefighting plus World Trade Center exposure increased cancer by 10%. That means that for every 100 cancers out there, 10 of them are World Trade Center firefighting related. The other 90 are general population related, and I'm going to come back to that in a minute. Other ways of looking at this statistically give you an even larger number. And you, depending how we sort the data, we could say that there isn't a 10% increase, that there's as much as a 21 or even 32% increase, which would mean that for every 100 cancers that we get, 32 are related to firefighting and World Trade Center, and 68 are related to just being part of the general population. And there are some specific cancers that even though we only had 10,000 people, so our power was small, there are some specific cancers that are incredibly worrisome, that are increased, and that align themselves very well with the NIOSH study. All right? Melanoma, prostate, thyroid, non-Hodgkin's lymphoma. All right? We didn't have nearly as many patients as we needed to look at multiple myeloma, but multiple myeloma was coming out in other ways as a potential positive cancer as well. So what are we doing going forward? We are linking up with these 3 cities. We're going to expand their cohort for the new people as well. We're going to look at other diseases. We're going to continue updating our cancer numbers every 5 years, which I'll show you in a moment. We're also looking at early diagnosis, using biomarker precursor studies to identify cancer early, using low-dose chest CT screening methods to identify lung cancer, colonoscopy to identify colon cancer, PSAs, mammograms, etc. Because the only way to treat cancer Now that we've shown that cancer is increased, the only way to treat it is to get the early diagnosis. So this is our first update from that study. This brings us to 2011. Of course, it's 2018 now, so we have another 5 and more years to keep adding. These are the numbers, but more importantly is this study, this figure, which shows above the axis here, it's hard to point here, but it shows, hard to point, but everything above the number 1 on the y-axis to the left, all right, is a significant increase. And you can see substantial increases in thyroid cancer, in colon cancer, in hematologic malignancies, and in prostate cancer. This is now adding all of our data up to 2011, and unreported 2018 even makes this worse. Now, what you also see is less in the FDNY World Trade Center cohort, less lung cancer than you would expect from the general population. So thyroid cancer is increased. It's increased almost 4-fold higher, almost 4 times higher than you'd expect in the general population. All right. Hematologic malignancies, melanoma, and prostate are increased as well, but not by such dramatic numbers. But lung cancer is decreased by nearly 50%. Now, why am I showing that to you? The NIOSH study said lung cancer was increased. But in our FDNY, World Trade Center Health Program, we see that it's decreased. The NIOSH study ended in 2009. The FDNY study on this slide goes to 2009, but we even have data that I just showed you to 2011 and forward. This is not to say we don't have lung cancer. We have many lung cancers. It's to say that it's not increased compared to the general population. It's still covered by the World Trade Center Health Program because of the bioplausibility. But why is it decreased? The reason we think it's decreased is because of the IAFF Wellness Fitness Initiative. Because in 1996, we made a commitment to reduce tobacco smoking, all right, to try and wipe out tobacco smoking. And what we did was we decreased tobacco use in our firefighters from about 19% to less than 6% over this time period. And we continue to fight that battle. But it's our lower than expected tobacco smoking rates that we believe is responsible for this, and it emphasizes that yes, we want to get rid of the 10, 20, 30 cancers out of every 100 that may be fire and World Trade Center or just fire related, but we also want to get rid of the 70 that are not. And that is by getting rid of smoking, by doing colonoscopies, by doing the screening that is necessary so that we can deal with reducing cancers and then diagnosing and treating and preventing them. And one of our ways of doing that is with cutting-edge, scientifically accepted mechanisms, such as a biomarker for multiple myeloma, which is called MGUS. MGUS is not an experimental biomarker. It's an accepted biomarker, so we know what it means and we know what to do with it. It's in the blood. It's in blood many years before you develop multiple myeloma. And what you can see here down at the bottom, I direct you to the very bottom of the slide where it says age standardized. And you can see that FDNY has a higher rate of MGUS than the general population. FDNY, World Trade Center Health Program, has demonstrated this. We are now going to reach out to all of these people with MGUS, all right, and get them into an early treatment and screening program to make certain that we can try to prevent the multiple myeloma from developing, and if it does, start that treatment early on. This is what it's all about. It's about preventing, it's about early diagnosis, and it's about state-of-the-art treatment without bankrupting our families. It's about giving every one of you hope, all right? Hope to survive. Thank you very much.